Welcome to the Highland Waves podcast, coming to you from Marshbrook Studios, located beside the wonderful Margaree River in Cape Breton, Nova Scotia, Canada. At Highland Waves, we feature stories about and discussions with the people and the places and the visitors in Inverness County. I'm Pat Wall, your host. This morning I'm pleased to introduce Johanne Doucet, site lead at the Sacred Heart Community Health Center in Cheticamp, Nova Scotia. Welcome to Highland Waves, Johanne.
Thank you.
You were born and grew up in Cheticamp?
I was born in Cheticamp. I'm one of 4 children. My father actually delivered me. My father is Dr. Claudio Coyne. He was a physician in Cheticamp for 49 years. So I was born in a storm. I almost was born in the car, actually.
Interesting. Dr. O'Coin saved me from an accident in Halifax.
Well, there you go.
Way back. So
he must have been an intern then.
Yes, he was.
Yeah.
He was in the back of the ambulance. A small world.
Yeah.
You were early educated in Cheticamp?
I did my high school at École NDA, and then I went on to Dalhousie, where I did my Bachelor of Science in Nursing. I graduated in 2002.
When did you return to Cheticamp after that?
Right in May of that year, I came back, and actually in Cheticamp at the time, there was no jobs for me. So I took a casual position there at Sacred Heart, and then I ended up in the ER at Inverness Hospital. And I got a position there, and I worked there for 5 years, and then I came back to Cheticamp in a full-time position.
Well, you've been successful both at work and at play in Cheticamp, because I noticed that you're the winner of the club championship at the golf course a year ago, I guess.
It was, 2 years ago, I guess, yeah.
What was your total score?
I shot, I think, an 87.
Oh, good.
Which was pretty good for me, yeah.
Yeah, and then you also were involved in the hockey team that won the Tiger Mackey Hockey Championship.
Yeah, I did that. I started my hockey career about 3 years ago. I'd never played hockey before.
Really?
I followed my kids in hockey for many, many years. And they decided to start a women's league in Cheticamp, and I got the gear and I got on the ice. I'm not very good, but I'm the captain, and I feel I'm a good leader. And we're doing well.
Good for you.
Yeah.
How long have you been the facility manager in Cheticamp?
So I took the job in 2019. I was a staff nurse before then, for sure. It felt like the right time to go to Monday to Friday. But I do miss bedside nursing. I think ER nursing is probably where I belong. And I still do shifts on the floor when needed. Actually, I worked yesterday and I'm working tonight because it's March break and my staff needs some vacation.
Okay, well, that was my next question, is whether you share your work on the floors as well.
Yeah.
I'm sorry.
Go ahead.
How old is the Sacred Heart Community Center?
So the Community Health Center was built in 1998 and opened officially in July of 1999. It took 3 days for everything to move from the old Sacred Heart Hospital to the new one.
It's considered a short-term treatment center. Can you explain that, please?
Well, it's considered a level 4 facility, so basic trauma facility is what they call it, because it's a rural site and we have definitely limited resources. So if you need like a specialist or if you get very, very sick, you would be transferred to the regional site, which is in Sydney, the Cape Breton Regional Hospital. Yeah, but we do manage acute care, palliative care. We have a few long-term care patients where people just can't handle being at home anymore and they need to be in hospital until they are placed into a nursing home.
So you're open 24/7?
We are open 24/7. We have never had to close our ER due to staffing or physician shortage. I do fear that may happen one day, but it's my goal for it never to happen, which is why I try to work to keep it open, to make sure that's why I maintain my skills and make sure that I can be that backup person for that not to happen.
Okay. What geographic area do you specifically cover?
So we cover from Pleasant Bay into the Margarees. Yeah. So I think the cutoff is actually Margaree Harbour Bridge, but we do have a lot of patients that would belong to us that are from Margaree, like even further down.
How many beds do you have?
We have 10.
Are some of those beds long-term care?
No, they're not considered long-term care, but we do have what they call alternate level of care beds, like patients that would be in hospital until they are placed.
What is the average stay, for example, of a patient in your facility?
Oh, it varies, but I would say maybe acute care, maybe 5 to 7, and long-term, it could be up to, 6 months, depending on the bed availability.
That would be depending on the bed availability elsewhere for them to move.
Exactly.
Yes, okay.
Yeah.
All right, what services do you provide, like for outpatients?
Well, we have an ER, so we are open 24/7 ER. We have some ambulatory care, which would involve like routine dressing changes, iron infusions, blood transfusions, anybody that needs to have that. We have a lab, we have x-ray, we have physio, OT, everything. I find that when we moved from Sacred Heart Hospital to the Community Health Center, all services became under one roof, including the medical clinic. So we are very efficient and we're very collaborative and we work very well together as a team.
Okay. Do you have ultrasound at your place?
No, we don't.
You don't.
So Inverness would be the closest for an ultrasound.
Yeah, that was my next question. That people, if their services are not available, do you send them off to Inverness or?
Yeah, so Inverness has a CAT scan or a CT scanner and ultrasound, so they would go there for further testing.
Okay. How many staff do you have?
So I think I have 17 staff under me. I'm the nursing manager, so we have 17 nurses.
What about doctors?
We have 4, so we're very lucky, and we have 4 local physicians, and yeah.
Do you manage the doctors, or are they managed from another area?
No, I do not.
Okay.
I manage the nursing staff.
Okay, and your nurses work 12-hour shifts?
They do.
Okay. And the doctors have their offices in the hospital?
Yeah, so the medical clinic was originally, when I worked in the medical clinic when I did my nursing degree, in the summers, so that was located in the pharmacy, where the pharmacy is now, the Cheticamp Pharmacy. But when the new hospital came in, the medical clinic moved there, which made it a lot easier for the physician on call to do, walk in the morning, and if there's an emergency case came into the ER, they just had to walk down the hall. So that was much more efficient for them.
Okay. Well, you obviously do have an emergency section.
Yeah.
Perhaps you can talk about that a little bit. What's involved with patients arriving and how long they stay, or where they're diverted to after where you can't provide service. What service do you provide in the emergency?
Well, basically basic emergency care, depending on the triage level. If they're triage 1, 2, or 3, that they're more emergent, so they would be assessed, triaged, and then decide where would they go. Do they need a CAT scan, or do they need to see a specialist? So they would either probably be transferred to Sydney if they're emergent.
Okay.
Yeah.
For our listeners, please explain triage.
Triage. So triage is the Canadian triage scale. So depending on your vital signs, if they're unstable, a chest pain is considered a triage 2. So that would get in a lot faster than an earache. You know what I mean? So if you're a 1, triage 1, it means you need immediate attention. So a cardiac arrest would be a level 1. You know what I mean? That's very serious. 2 would be chest pain. If you're having a heart attack, you need immediate service. You need an EKG within 10 minutes. And if you are having a heart attack, you need the clot buster, which we call TNK, within 30 minutes. Yeah.
Is there a doctor in the hospital all the time?
No, so level 4 means that the doctor is not required to be in-house at all times, but they are on call, so we certainly would call them in, and they would come in if needed.
How long does it take the doctor to get into the hospital if he gets called?
20 minutes at the most, because they don't live very far.
Okay.
Yeah.
If I cut myself, let's say, after 8 p.m., and I decide to drive myself to your hospital, what happens there?
So you would come in, we would, if we would probably call the physician, we'd do your vitals, we'd, dress the wound, and we would call the physician in, and he would come in and give you a few sutures, and you'd be on your way. And a tetanus shot if you need it.
Okay.
Yeah.
And if I were to arrive in a hospital, or at the hospital in an ambulance, what happens?
Oh, an ambulance, you would get into the room pretty much right away. You know, there's a lot of issues with offload time sometimes in the bigger hospitals where they don't have areas to offload the patient, but that rarely, that never happens in Cheticamp. We usually have a stretcher for you. We make room for you. We would assess you, and based on your symptoms, you would get the treatment we can do.
What are the major challenges for you in administering your facility?
Definitely RN recruitment. Definitely. I am now down 2 full-time RNs, so that makes it really hard to make sure that all shifts are covered, and yeah.
What are you doing in that regard in terms of recruiting? How are you recruiting or trying to recruit for people?
So we do have a recruitment team, and the jobs are posted on the Nova Scotia intranet, and we just try to bring back people that offer incentives. There are incentives for new staff, significant monetary incentives, and let's try to advertise and bring back people to Cheticamp.
Well, we have a fairly wide, we're on YouTube, and we have a fairly wide audience.
Yeah.
What would be some of the incentives, if you can tell us that would address somebody wanting to come here?
So if they were moving, probably moving expenses would be covered, and depending on how long they would want to sign, that would depend on your
income
sign-on bonus.
Okay.
Yeah.
The provincial government, the new provincial government, the Houston government, if I can say that, seem to be concentrating a lot on the healthcare field.
Yeah.
What changes have you seen in your facility that have resulted from their decision to focus on the healthcare system more?
I think where they gave the thank you bonuses to the existing staff, that was a really mood booster, and they felt, appreciated and heard. I think that would be it as far as us. I haven't, like I said, there's not many applicants, unfortunately, to the rural sites. It's a very hard place to recruit, and the cost of living, the cost of housing, is a major factor. Yeah.
What about in terms of the funding for your hospital? Is that changed under this government, or is it remain the same?
It's about the same. Unfortunately, many of the hospitals are a little bit over budget because we've had to had travel nurses in to try and cover some lines there, but you have to do, this is what needs to be done right now until we get permanent staff.
What changes would you like to see that would make it easier for you to provide better service to your community?
I think overall that the Sacred Heart Hospital provides really good care to their patients. I don't think I would change much, honestly. I think we run a very good ship, and the physicians take very good care of their patients. Other than staffing, I don't have any complaints. I really like where I work. My staff is wonderful. They provide great care to their patients, and I don't think I would change much.
Well, that's very good.
Because it works right now. Like I said, I just said if I had just that extra few nurses to run the schedules and make sure all shifts are covered, that would be the only thing I would change right now.
Do you have a mechanism where patients can provide you feedback, or those who have been served at your institution can provide you feedback? Yes,
there is actually a Nova Scotia feedback line, and I don't have that information right with me, but that poster is posted in a few spots in the hospital where patients could call or actually email any feedback, whether it's good or bad. And if I get a complaint, I usually follow up with a phone call, and
You're completely funded by Nova Scotia Health?
Yeah.
Okay. What about a foundation? Do you have a foundation operating in your area?
We do. The Sacred Heart Hospital Charitable Foundation was founded over 30 years ago. I'm a board member. I am a member of that. They actually raised, when the new hospital was built, they actually raised $1.4 million to help with that. So, and they do the weekly 50-50 draw at the co-op, and that helps raise funds. And they are very supportive. Any equipment that we need, they are usually ready to fund it.
Oh, that's good.
Yeah.
How do people donate?
So right now they can only donate by check. So you would email your check to the Sacred Heart Charitable Foundation at P.O. Box 129, Cheticamp, B0E1HO. Yeah.
What advice do you have for people in your community that could help them help you provide better service?
That's a tough question. Help me.
Well, I think that if they're providing feedback to you,
Yeah.
you know, how they were treated at your hospital,
Yeah.
I think it would be one of those.
Yeah, so if there would be if there was ever like something that they were unhappy about, and I would certainly talk to them about it, and I would certainly look at ways to make it better by talking to the staff, like, do you think we should have handled this differently? Is there something that you think you should have done better? That type of thing, for sure.
Okay.
Yeah.
If a person has a bad experience, I'm not placing any fault here with anybody, but if
Yeah.
somebody had a bad experience in a doctor's office,
Yeah.
how would that be resolved at your institution?
So the doctor's office actually is a private entity. So the Cheticamp Medical Clinic is a private, and they rent the space from Nova Scotia Health. So if there were complaints that came to me from the medical clinic, I certainly would talk to the physicians about it, but it would be their
responsibility.
Exactly, to
Okay.
deal with it. It's not mine.
Okay.
You know what I mean? So anything that happens on my side, on the ER or the medical unit, I certainly would deal with. But yeah.
So complaints about doctors would eventually probably go back to the medical profession
Yeah.
or their association
Exactly.
to be resolved.
Yes.
Yeah, okay.
Exactly.
Okay.
It would be investigated and
Yes, of
dealt
course.
with that way.
Yeah. Well, it's a short interview, but before we wrap up, I'd like you to give you the opportunity to provide any information that you would wish to provide to your community.
I just want to say that I'm very proud of my little community health center. We have an amazing and dedicated staff, nursing and physician, and all the other disciplines. I'm just going to say a few things that, like, some successes we've had is that we started a pilot renal dialysis unit, which is basically home dialysis but in the hospital, because some people really can't. It's difficult to imagine that a patient and their family would be running their own dialysis unit in their house. Not everybody can do that. So we now have 2 patients which get dialysis 4 days a week. So that's a very big success. So, and they don't have to travel to Inverness 3 days a week for that. So that's good. And we are looking for a second LPN in that department. So this is
LPN is
a licensed practical nurse.
Okay.
So this is my plug. We're trying to recruit another LPN in that department. It's a day job. It's a great atmosphere. It's a great little job. We've never had an ER closure to date, and I'm very proud of that. And it's something I never hoped to go through. We also have 2 internationally trained nurses from the Philippines that we've hired, and they are now on their own and wonderful nurses. So I'm very, very happy about that. We are also connected to the nursing home. Like, the hospital is now connected to the nursing home, which is very efficient. We have some shared services there, and it's with laundry and dietary. And it's also easier for the residents from the nursing home to come over for medical care, whether it be lab, x-ray, or even the ER. And the physicians also can just cross over quickly to assess them if they need help. So that's very good. It works very well.
You seem in your few comments you made about how proud you are that your emergency department has not been closed. Bedeck, for example, has been closed for a lot, and some other small communities have been closed a lot. Why is that?
Lack of resources, no physicians, no staff, no ER trained nurses, probably. Yeah.
I know I have a friend who's on the board of the hospital in Badek, and he's telling me now that if somebody has not an emergency, but something that needs to be addressed, they have to call the hospital before they arrive so that somebody's there for them to come in.
Yeah, so they have, their ER is closed, but they have an urgent treatment center. So depending on your complaint.
Okay, so an urgent...
So you have to call in, you have to call in before you go to get an appointment, and then you go in. Yeah.
What was the term you used?
It's an urgent treatment center.
Urgent treatment center.
Yeah,
okay.
And they have a set list of, exclusion, of
what they'll address and what they won't address.
Exactly.
Right.
Yeah.
Well, thank you very much for coming out to explain to us about your job and about your institution. Yeah. And I'm sure it's very useful to our listeners. And you have a very busy and complex job, and you seem to be doing it very well. And I wish you well in the future.
Thank you.
And I want to thank our listeners. And please hit the like and subscribe button so you know what's going on. And to subscribe to Highland Waves is free. And I'm going to leave you with a quote for today by Josh Billings. And he says, "Health is like money. We never have a true idea of its value until we lose it." So long for now, Pat.